Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Luntz. I am your host, and I'm here to talk to you about all things dental hygiene. I'm here to support you through the dental hygiene program and beyond. Today's topic is about fluoride. This just keeps coming up in conversation. And the more I talk to students and patients about fluoride, the more I realize there's just so much misinformation out there, and people really need to understand fluoride a little better. So let's start at the beginning. And I've got several episodes out there already on fluoride that covers kind of the history of fluoride and how we discovered. Sorry, I have to take a sip of my coffee. How we discovered the benefits of fluoride. And one of the main things that I've noticed when I'm talking to patients about fluoride is that they have a hard time understanding the distinct differences between systemic fluoride and topical fluoride application and how those coexist together, what the need is for them, what the benefits are for those two different delivery systems. And I think the best thing to do is start at the beginning and talk about caries risk. Because if our patients can understand the why behind the valid use of fluoride, then they can make their own educated decisions and really weigh the risk with the benefit. Because honestly, everything in life comes with a risk. And when you think about anything that you've done in your life that requires a risk, there's the benefit that outweighs the risk that actually initiates the opportunity for you to make the decision to do so. And I would approach fluoride the very same way. So when you think about all of the knowledge and understanding that you have behind caries risk, and if you base your educational methodology with your patient around that caries risk, it's going to help your patient understand the why behind the fluoride and then let them make the informed decision. But you guys, if you think about any decision that we make in our lives, if we make a decision based on understanding and knowledge, it makes it seem more, it's like we're advocating for ourselves. We actually have agency over the decisions that we make. And as a provider, that's really our job. Our job is to inform and educate our patients about the latest evidence and what the research is telling us. So starting with the caries risk classification and informing our patients about where they reside on that caries risk. There are so many great resources out there that give our patients, that provide us with the opportunity to give our patients the knowledge base that they need in a very simple way. So think about your patient who has a low caries risk. What is the criteria that would put that patient in a low caries risk situation? Let's think about that. So they're motivated. They have great home care habits. They have no history of caries or no active caries going on currently in their mouth. They have no areas of recession. Now think about why that's important. We know that the pH of the saliva doesn't have to dip down as far, right? What's that magic number, right? It doesn't have to dip down to the 5.5 in order for the demineralization process to happen. It only has to dip down to about 6.2 for demineralization to start on those root surfaces. So someone with recession would definitely be at a higher risk of caries than someone without recession. So think about how the anatomy, the saliva, the diet, all of the things come together to provide you as the clinician with an accurate caries risk assessment when you're doing that and you're gathering that information. So there's no recession present on your patient. They're not taking any medications that would cause dry mouth, and they don't display any or exhibit any signs of dry mouth either. So this would be your low caries risk patient. There would be no extra fluoride needed. They're on a 6-month recare. and they have fluoride treatments at their recare visits, and that is an adequate amount of fluoride topically applied to that patient to keep their caries risk low, right? We're always about either prevention um, or remission, right? We want to either put our patient in remission for caries or we want to prevent the caries. And so classifying them accurately provides us with the steps of what we think should be adequate for our patient. Let's go to moderate caries risk. And this is stuff that you want to share out with your patient. Tell your patient where they fall on the caries risk after you've done your caries risk assessment to let them know that they fall as a low caries risk, and this means this. So it's important for you to not only do a proper caries risk assessment on your patient, but to then share that information with the patient so that they can be engaged in the process of learning about where they are. When our patient has moderate caries risk, they have had one carious lesion in the last 12 months. They present with very deep pits and fissures in their occlusal surfaces or even on the lingual aspect of those maxillary anterior teeth, which can sometimes happen. Their oral hygiene is fair. When you are doing your plaque index score, they have a moderate amount of plaque biofilm. They have inadequate fluoride in their water system at home, and this piece is a really hard one to kind of dial in. Sometimes your patient is aware of this, and sometimes your patient is not aware of this. And I'll tell you, it's important for you to do your due diligence to try to nail that down and find that out because that really helps you make the proper recommendations to your patients. There's an incipient lesion, at least somewhere in the mouth, right? So whether they have one or two, they're still at that moderate risk. They may have some areas of recession. And then the other piece that puts your patient in a moderate caries risk category is if they're irregular with their dental visits. This is someone who, you may make them a 6-month appointment, but by the time you end up seeing them back in your chair, it might be 8 to 12 months because of other circumstances. It could be work or finances or life, just all kinds of reasons why this patient is not able to make their routine care a priority. And that actually puts them in that moderate caries risk. Because if you think about the preventive services, actually having a prophylaxis, having a visit with the hygienist, and going over all of these things and reviewing the at-home efforts and going over the tissue health, doing a gingival assessment, doing the caries risk, taking those radiographs, all of those things are part of that preventive care. And if your patient is irregular on their schedule, it puts them at a higher risk of both caries and perio. So the caries risk assessment also is indicated for irregular dental visits. It does bump them up to that moderate caries risk. So think about some of the things that are recommended when your patient is, if you've determined that your patient is in a moderate caries risk, we're recommending at-home fluorides based on the things that have put them in that caries risk assessment of moderate. Maybe in-office fluoride treatments. If they have those deep pit and fissures, we're recommending dental sealants. If you have discovered that the reason for the incipient decay that they've presented with at your visit uh, provides a need for dietary counseling, then we're going to definitely recommend that. And patient education. Are you taking the time to determine the reasons why your patient is showing up with these incipient lesions and then moving forward with a care plan that actually attacks those issues? It may be that your patient is not brushing enough. Maybe they're not brushing long enough. Maybe the way that they're brushing is a technique that needs to be modified. These are things that you want to kind of nail down as the provider so that you can help bring your patient back to a low caries risk. And then Are high caries risk patients. So, what would put our patient in a high caries risk? If they have had two or more carious lesions in the past year, and maybe you have found that your patient has presented with a history of smooth surface caries. That also puts them in a high risk because think about this. The risk of smooth surface caries is lower than having carious lesion in these deep pits and fissures. So when your patient shows up and they've been diagnosed as having a smooth surface carie, then you know that things are not in balance as far as what's going on in their oral cavity. So if that patient has none or very little exposure to fluoride, they are automatically at a high caries risk. We want to make the determination that they are getting at least some fluoride exposure because we know that demineralization and remineralization process is slowed down. That demineralization is slowed down when this fluoroapatite inside the enamel crystals, right? That's embedded in that tooth. So if there is no fluoride exposure or very little exposure, we know that that's being extracted over time through the normal dietary process. So we want to make sure that we're indicating that when we're thinking about the risk assessment of our patient. If our patient is having inadequate home care, poor oral hygiene, the inability, maybe they have very low dexterity, maybe they've had a sickness or an injury, or something is going on in their life. Maybe they have depression, something that has caused them to have poor oral hygiene and the inability for them to really maintain that plaque biofilm, especially in those cervical and occlusal areas. We want to make sure that we're finding out through the interview process, we are investigators as dental hygienists. We go in there and we ask all the questions. We are inquisitive. We are curious. Why? Because we care. We care about our patient and we care about finding the right, proper treatment for that specific patient that is right there in front of us. That is one of the things that I absolutely love about dental hygiene is that it's so personalized. When you're working with your patient, one of the things I will say, not to get totally off track, but one of the things I will say is, unlike when you go to the physician, the hygienist is looking at you the whole time. It's a two-way eye contact conversation, except for when you're wearing your ergo loops. But most of the time, and you're in their personal space. So some of the things that occur while you're in the chair, as a provider, it's very intimate. And that's what I will say about being a hygienist that I just love compared to, being a nurse, or being a physician. Not dogging on them. I'm sure there are things in those professions that are unique to them. But what I love is that we can just proceed with curiosity all the time and ask those questions and really connect the dots for our patient to bring them back to health or to help them maintain the health that they're looking for. So the other thing is if your patient has frequent sugar intake. Now, I know it's the holidays and we could all have a little bit of sugar intake, but what's going on over the course of months and months, right? What is going on with your patient? Are they constantly, I gotta have a sip of coffee, hold on. Are they constantly sipping on sugary drinks? Are they having frequent meals? And what are they doing in those times to buffer the pH? And are they even aware of what the pH in their mouth does and how that impacts the caries risk when they're doing these behaviors? Oftentimes we have patients who are super healthy and they're focused on health and they're doing smaller meals, more frequent meals to keep their metabolism at a certain rate, and they're not even recognizing or realizing the impact that that's having on their caries risk. So these are conversations we want to have with our high risk patients. Or if we see all of a sudden there's a change in a patient, maybe they've started drinking Red Bulls or something, or some of these really popular new drinks out there, and they're not even realizing the sugar exposure and the acid exposure. These are the important topics you want to talk about. It's not only just assessing your patient and coming up with the risk, it's finding out the why and the connection, the personal connection to that patient to help them move the needle and change a behavior? So these are the questions we're asking so that we can tie it all together for them. And then our high risk caries patients also have irregular dental visits, and they may just have, you want to find out the reason behind those irregular dental visits that cause an increase in their cavity propensity and their cavity risk. And then the decreased saliva flow. There's naturally occurring saliva flow decrease. Our saliva thickens as we age. I tend to see this in women over 60 that even if they're not taking any medications, their saliva will thicken a bit. And they don't necessarily self-report this. It's something that you will notice as a provider when you're in there working with your patient, that they may have a decreased flow of their saliva. Those glands just are not producing what they once did. And the thickening of that saliva will cause the same outcome of the caries risk assessment that you do. When you see your patient, their caries risk goes up because they don't have that saliva flow in all the areas, that natural buffer. And the other thing, when the saliva flow is either thickened or decreased, we don't have all of that calcium and phosphorus in the saliva to get into the mineralization process, to be part uptake in the tooth and the enamel to actually remineralize those areas. So that actually depletes as well. So these are the primary considerations for high caries risk. So what do we recommend for our patients who present with a high caries risk? We're definitely going to look for ways to supplement or provide prescription fluorides for these patients. And we may even provide them with fluoride trays to use at home to really get concentrated fluoride to the enamel structure, because we know the benefits of fluoride and we know how important it is to get that fluoride uptake into the enamel to help prevent or arrest these decay areas, to keep things, to get things more stable, honestly. And then we are definitely going to talk to our patients about the benefits of in-office fluoride treatments when they are under our care. And based on what their medical history presents, we're going to think about what fluoride is best suited for this particular patient. We are definitely going to spend some time on patient education. And patient education is not just about having them pick up a brush and you show them how to do a modified VAS. I feel like as a student, I want you to think about all the things you learn while you're in school, and there's so much more to patient education. I have I have seen in my own career that sometimes patient education is simply, just giving a couple of breadcrumbs of behavior changes that your patient can do. The patient comes in very defensive about flossing. Sometimes I intentionally don't ask about flossing because I already know the answer. So why create that barrier between you and the patient who has a high caries risk? If they have a high caries risk and they have recession and root decay and occlusal caries, the fluoride is beneficial. The flossing is not going to help your patient at this stage. So baby step your way to progress. And the modified BAS might not be what they're ready for either. So I want you to be thinking about what type of patient education is necessary for this patient. Because as a hygienist, you have so much knowledge about all the different ways that you can help this patient get to stability. Don't just sound like the same with every single patient. I've heard hygienists do this. I want you to find something that you can connect to your patient. What is that vital behavior that you can get them to do based on what they've shared with you as something that's important to them? What do they value? That's really what you want to nail down. And if I have to say, if I had to pick anything on this list, whether it's at-home fluoride, in-office fluoride, patient education, dietary counseling, I would pick the patient education over everything else because we see the patient like a tiny little bit. We're just this one little piece of the big pie. What our patient does after they walk out of our office is completely up to them, but we have much more impact than we realize. So that's something I want you to think about. Okay. And then Dietary counseling can be brought into that if you suspect that maybe your patient shows up. I've actually seen this so many times. Maybe your patient shows up with an iced coffee with 4 sugars. And of course, I'm sipping my coffee as I'm recording this podcast, so this is so bad, okay? I just want you to know that I will be brushing my teeth after this episode. We know that coffee is very acidic. I do not have sugar in my coffee, just by the way. But maybe your patient shows up and they don't even have to say anything. Maybe they show up and they're holding a iced matcha latte or something, whatever they have. Or maybe they tell you about it, or maybe you've asked a question or two, something that prompts an understanding for you to provide just a little bit of dietary counseling and kind of wrap it all together so that it doesn't come across as a lecture. It's part of the natural conversation that you're having with your patient. Remember, we're leading with curiosity. The other thing that's super important for your high caries risk patients is to make sure that they're maintaining a 3 to 6 month interval for their visits with you. I have had patients come more often than 6 months because of a high caries risk. For some reason, we think about that with our perio patients, but if you have someone who has poor oral hygiene and they're having a really hard time managing their biofilm, shorten up their intervals so that you can have more exposure and provide them with more support. Those are definitely things that you want to think about. And then if there's an opportunity to put dental sealants in some of those deeper pit and fissures, you definitely want to do that. The other thing I wanted to share is povidone iodine. I love that so many people are using this. Povidone iodine is like this ancient old secret that we've had forever that works so incredibly well. We know that when we combine the application of povidone iodine and fluoride varnish together, it really ramps up the efficacy of the fluoride and it helps with dental caries. It also helps with tissue health. I mean, what a win-win, right? I think people kind of panic when all you do is you take a cotton tip applicator and you slather the povidone iodine on the patient's teeth, and then you put the fluoride varnish on. And I think people panic because it's bright orange. It does not stain your teeth. It doesn't dye your teeth. It doesn't do anything. And as a matter of fact, once you put the varnish on, the povidone disappears. It's gone. I tell patients it tastes kind of like a Band-Aid. That's how it tastes to me. It might taste different to you, but you should definitely do it on yourself and try that first. But the fact that it helps with tissue health and it actually helps with the efficacy of the varnish, it's just a win-win. And when you use that, you can educate your patient about the use of povidone iodine. And here's the best part for our patients. This is about access. A lot of this stuff is about access. And so povidone iodine, they can go right to their local supermarket. They can buy a big old bottle of povidone iodine and it's super cheap. It's like $8 and that thing will last them an entire year. And if the povidone iodine is going to go a long way in reducing dental caries and it's easy for the patient to use and it's easy for them to find and it's inexpensive, unfortunately, it's not well marketed. Um, this is something that we should definitely be educating our patients about. So it reduces the bacterial load, the strep mutans, and the combination of the fluoride varnish and the povidone iodine, it allows that fluoride to work more efficiently to rebuild the enamel. So whatever we can do to maximize that. And then it's really important for you to know what fluoride varnish, what fluoride application you should be using with your high risk patients. So, and what you should be saying to your patient as far as instructions that follow. But that is for another episode. This episode was all about the caries risk assessment. I really hope that you guys can utilize this information when you're working with your patients. Be confident in your assessment, ask good questions, and remain curious. If you need any support with any topics, as you know, I'm always here for you. You can definitely find my email or contact me in the show notes, and I'd be happy to produce an episode that covers just about anything. If you need a visual reels or instruction, I post stuff on Instagram. It's at the Happy Flosser. I post things on TikTok. It's at the Happy Flosser as well. Whatever you need. As a student, there's so much for you to learn. As a new clinician, there's so much for you to develop and implement and kind of put into the hands-on component. And sometimes You need help from others, and that is okay. That's what we're here for. I hope you guys have a fantastic week. I'll see you soon. Hey everyone. Dental hygiene school can feel overwhelming. The long nights, the pressure, the moments when you wonder if you're really cut out for this. But I just want you to know that you are not alone. The Happy Flosser RDH is here to walk with you through every chapter of your journey. Each episode offers hopefully a breath of relief, a voice for you to know that I understand what you're going through. I'm here to remind you of your strength and help you find your footing when you need it. And with the Happy Flosser study notes, you can get clear, compassionate resources that are designed with love to make your learning feel possible, even on the hard days. You deserve support, you deserve to feel seen, and you deserve to become the hygienist that you are meant to be. The Happy Flosser RDH is where your journey is honored and your growth is celebrated. One step at a time. That's how we get there together. Use the resources that you need. Everything is listed in the show notes for easy access for you.